Bismillah ar-Rahman ar-Rahim. My dear colleague, medical practitioner all over the world, today I have the pleasure to have a talk with Professor Ahmad Halawa. Professor Ahmad Halawa is a well-known, eminent professor in nephrology science. He has a professor degree in Sheffield University in United Kingdom. Most of his practice is in United Kingdom, and he's also is the ambassador of the Nephrology Society in the Middle East and North Africa. He's very well known for his courses about thyroid, parathyroid, specialized transplant procedure, difficult transplant procedure. He's also an editor of a lot of books in nephrology atmosphere. One of the very nice chapters that he actually have published is transplant for the fourth time. How is the result is going to go? He's very well known, and he's going to speak to us today about e-learning, a new platform that he has pioneered, and he has his own platform, his own courses that a lot of people recommended to use. I will leave the talk for Professor Ahmed Halawa, and just very few questions whenever there is time, we'll ask to emphasize how to benefit from e-learning in our region, Middle East. Professor Ahmed Halaw.
Thank you, Dr. Muhammad Omar, for this kind introduction. Basically, I'm a transplant surgeon, not a nephrologist,
Mhm.
to start with. However, transplantation is part of nephrology. In the UK, many transplant surgeons deal with the medical as well as the surgical aspects of transplantation. We believe transplantation is just not a plumbing work, it's not a carpentry work, it is a science which involves the medical as well as the surgical aspect of transplantation. The surgical aspect of transplantation is minimal compared to the medical aspect of transplantation. So my background is general surgery and vascular surgery, and then I became specialized in transplantation. Transplantation is is an art. Immunosuppression is an art. How to manage these difficult patients is an art. This art based on science rather than based on practice. Practice makes the science perfect, and perfect, and the science, make the practice also perfect. Thank you, Dr. Muhammad Omar, for this nice introduction. Is e-learning basically, you can summarize it in few words: anytime, anywhere. This is a conclusion of e-learning. Anytime you can learn whenever you have time, busy at work, busy with the family, cannot take time off. Anywhere, you didn't need a visa, you didn't need a passport to learn. E-learning cross the borders without any obstructions, without any restrictions, without any limitations. So this is a conclusion of e-learning. E-learning, we learned a lot from the COVID era, where we don't see patients quite often during the COVID era, but we used to Zoom, meeting them, telephone calls. We discovered that it works very well in most of the cases. However, few patients needs to be seen face to face. So e-learning most of the time can work very well, provided that we have the technology. The technology has lended itself very well to e-learning. If you, the requirement, basically, you need a laptop and internet, as simple as that. You don't need to be formally dressed like Dr. Muhammad Omar now. You can learn while you have a cup of tea in one hand and your feet on a stool or a chair next to you, watching the telly while you are learning. So it's at your ease, at your own pace. It's enjoyable, allows people who are busy at work to carry on learning. So this is a conclusion. This is this is a summary of e-learning. Uh, The question is, do we need bedside learning? Of course not. This is a misunderstanding because bedside learning is essential for undergraduates, where you practice the skills, clinical skills, learn the clinical skills, palpation, percussion, auscultation, and what else? Listening to the heart is important at the undergraduate, but now we have technology, ultrasound, echo, CT angio, all those things actually will cover all the defects in the clinical skills. Also, do you need to see the patients as postgraduate? Most of the time you don't, because you have a team who can pass a message to you, give you the clinical picture, and you make a decision. So it's
Yes.
all about decision making, all about critical thinking, how to take a decision, how you make a decision. This is what you need as a postgraduate.
Yes.
Bedside management is rarely needed or needed at the end. So in e-learning, you learn many skills, but there is a small portion of the learning will be left entirely to your own practice. So your practice is important. And this is
Okay.
what you do. You learn and then you practice.
Yes.
So bedside management, bedside learning is not essential because we are learning every day. We see patients every day. And what you need is to apply the e-learning, the skills you learn from the e-learning, and apply it into your practice straight away. E-learning actually now is a standard education in many universities in the West. You know, I had a master's degree in medical education, and I did it as e-learning. And as part of being university staff, as part of being University of Sheffield is around the corner because I have very busy clinic and busy theater lists. I did it online. It was very convenient, very comfortable. I learned a lot. And while I'm learning, I'm practicing at work. So this is all about e-learning. The standard teaching where you need a blackboard and chalk is gone, is dead long time ago. So e-learning is the future. Fine. So let me, let me answer the questions first posed by Dr. Muhammad. So what are the questions you want to ask, Dr. Muhammad?
Yes. We have heard that there is a master degree in surgery, which is by e-learning. So, which platform, what it offer, and how they are accredited uh,
Yeah,
for the junior staff?
yeah. There are many master degrees by by famous universities, reputable universities. They use and there are many platforms you can use, for e-learning. Canvas, Vital, Blackboard, and actually they can you can rent or hire, subscribe to one of these platforms, but you need IT support to design it for you. It's not that difficult at all.
Yeah.
The platform, the more expensive the platform, the more e-learning you get. So don't save money by getting a cheaper platform with less facilities.
Yeah.
The platform allows tracking the student's contribution. The tutor's contribution also is like Facebook style, basically. Somebody
Yeah.
put a post next day morning while you're drinking a cup of tea, you see the post, you reply. So again, it's asynchronicity helps the e-learning. So the platform allows many things, and I will demonstrate one of the platforms I used. We got the platform in its very primitive nature, and we designed the platform to suit us.
Okay.
So, any other question, Dr. Muhammad? You say
There are some questions. How do you get accreditation? And how
accreditation.
do you build a medical course?
Yeah,
You said you need an IT support. How do you build the lectures? Is there special tools that you build up
no.
your lecture? All these are questions with e-learning.
The lectures are audio lectures. PowerPoint itself allows recording of the lecture. And
Okay.
what you need is a good IT support, to upload it into the platform.
Okay.
Accreditation. There are many accreditation bodies. In the past, we used to think accreditation only provided by universities. The answer is, of course, not.
Okay.
Many accreditation body all over the world. American Association of Continuing Medical Education, you have the European Accreditation Council Continuing Medical Education, and so on. There are many accreditation centers in the Middle East, especially in Emirates. There's one in Egypt. There are many accreditations body which you can apply to get accreditation.
Okay.
So it's not necessarily to be through universities. This is a misunderstanding.
Okay.
Royal College of Surgeons, Royal College of Physicians, this is not a university. Yeah. In
Yeah.
spite of all courses are accredited by them because they can offer accreditation. So
Yeah.
this is a real example that accreditation not entirely in the hand of universities.
Yeah. Okay. And do you must have a website beside the architecture of the learning environment, or it is not needed to have a website?
No, I mean the platform actually is a website. So
Okay.
the platform it has to be built up properly by the IT support to
Yeah.
suit the e-learning. You get learning management system. If you Google learning management system, this is the broad terms or broad name of the platforms. You
Yeah.
have different learning management systems.
Yeah. The LMS, yes, is very and you did
Mm.
mention Canvas, which is used by Harvard University.
Used
Um,
by many universities, including UK here as well.
okay.
Canvas is yeah Canvas is a very expensive
Yes.
uh, software, but you can use cheaper software.
Okay. Which one do you recommend for beginning of e-learning journey?
No, I mean I recommend good IT support and build and subscribe to one of these platforms and then build it up. And this
Okay.
is exactly what we did.
Good.
We yeah. Let me show you the platform we have.
Okay.
This is the World Kidney Academy. If you click
Yeah.
here,
This is a platform that you put all your courses
yeah,
uh, in it. Excellent.
yeah, absolutely. So, and this is an announcement. We'll go straight away. Look here.
Okay.
Log in first.
Yeah.
Use the name and password.
Yeah.
So, if you see, this is our platform. This is
Yes.
home.
Excellent.
This is actually the front page.
Yeah.
all designed by our IT support. And these are the courses.
Excellent. How many courses are there? Is it something like 20 or 15?
No. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and 13th is coming.
Excellent, excellent. And I can see you're covering the glomerulonephritis fellowship. This is brand new, so you pick up a small topic, and usually this course is for 6 months or 1 year.
Yeah, 1 to 2 years. And there are short courses as well for 6 weeks. So it
Excellent.
depends on the course.
Yes.
Glomerular practice, this is,
Okay.
a part of nephrology course. You can
Yeah.
see renal replacement therapy. This is again,
Yeah.
this is transplantation. This is donor transplantation workshop, fellowship in
Yeah.
clinical research, CKD MBD graduate certificate program,
Yeah.
diploma in
And
uh,
inside any of these courses, without revealing any confidential information, you'll find lecture, exercises, MCQs, and
yeah,
assessment. Is this what is
yeah,
inside?
yeah. Let's just go and explore one of them. Look, read.
Oh, fellowship in clinical research. That's very good.
No. Yeah. I mean, but I'm opening a fellowship in clinical transplantation.
Okay.
So this is a front page, and then register now.
You have two
And
modules.
well, yeah, no, we are in module 2. We have, yeah,
Okay.
and this is, yeah. If you look here, announcement for the students, curriculum, where the module
Yes.
staff, module leads, module overview, files.
Excellent.
In files, actually, we upload the lectures in PowerPoint,
Okay.
in PDF file. Academic
Okay.
and supporting resources. Academic supporting resources is academic material which has no title, like
Okay.
presentation skills, writing, plagiarism and research dishonesty, all sorts of things like this. This is
Excellent.
curriculum.
And this is open 24/7 from anywhere in the world.
24/7, anytime, anywhere. You can see here,
Yeah.
this is week 1, and this is what's in week 1, and this is week 2, because we are in week 2 now.
Okay.
So a week, and this is a typical lecture here. You can see if you click on
Yeah.
the lecture,
Yeah.
applied transplant immunology case-based discussion part 1, and you see this is an audio lecture. Click on the button.
Fantastic. Fantastic.
Hi everybody, I'm Professor Ahmad Halawa, consultant transplant surgeon, Sheffield Teaching Hospital, United Kingdom. I'm going to take you through applied transplant immunology. Basically, it is the review of what we have studied in the previous module. My lecture is divided into 3 parts to cover the topic of clinical transplant immunology.
Excellent.
I am going to take you through a guided tour to discuss and address the basics of applied transplant immunology in 3 parts. Disclaimer: I don't claim, and I will never do, I will never claim that I am experienced in transplant immunology. I try to get an explanation for any immunological challenges I experience in my own practice. What I discovered that what I don't do is much more compared to what I do. I am still learning. The objectives of this talk will discuss few topics may not be covered well previously, and this is why we thought it's better to address them in a different talk. We'll discuss the calculate. Yeah,
You can
so
see very
basically,
interesting topic and very clinically oriented in a very nice manner. And after the candidate um, pass exam, you must have an assessment at the end of these
course,
courses.
of course.
Okay,
Yeah. There's two assignments at the end of the course based
excellent.
on what studied. Here, actually, it's important, this domain here,
Yeah,
when I asked the students just to summarize the lecture.
yes. Brief summary of the lecture. Yes,
Mm,
that's very good. It will show you how much he understand.
absolutely, absolutely. And the
Excellent.
system counts contribution because, some of the students are a bit late.
Yeah,
So all these people. And then the tutor jumps in after a few days to see this
yeah.
contribution
And you told me that some of your courses
and
have
they
something
comment.
like 100 students.
This is a tutor here. It's marked as a tutor. Professor
Yeah,
Ehab Shaheen
yeah,
replied, then again, replied again,
excellent.
then replied again. And this is another Professor Asia Sharma replied,
Mm,
and Ehab again. Yeah. So and so on. I mean,
yeah,
this is how this course is designed. And
okay.
then let me take you to the clinical scenarios. I have to go into the top, then clinical scenario one.
Excellent.
This is a clinical scenario here, and this is a tissue typing and cross-match report with few
Okay.
questions on it. And you see here there's 85 comments.
Yes.
And
Quite
then
intensive course.
he
It
replied,
must took a lot of time to create such a course. Maybe 6 months is heavy work.
yeah, it takes 6 months a year to build
Yeah,
up a course,
to make
but
a course
once
like
it's
this.
built up, it runs smoothly.
Yeah, yeah,
The,
excellent.
you have to put an effort, a good effort, to design a good course, and this
Yeah,
is another. It looks like this guy he didn't respond to all questions properly.
yeah,
Professor Dawda Bilal, try again, respond to all questions. Looks like he's trying to cheat. And then this is again, replies. So the
excellent.
same applies here, everywhere here. You can
Yeah,
see the clinical scenario, 1, 2, 3, 4, 5 clinical scenarios. Join the club.
yeah. And journal club activity, you present one of the
Join the club is
landmark.
run the same way as the scenarios. But the difference is we upload the article and you can download it.
Yeah,
And there's a question on the article. Please summarize this article emphasizing the different techniques of teach typing and course matching.
Excellent.
This being addressed in the lecture. This is actually one of my articles, and you can see here the
Yeah.
response from students.
Oh, yes.
Uh, these students which wouldn't reply to are late because maybe they are late in joining or busy at work. Then they logged in and reply to the questions they have missed.
Yes.
So I would ask them to summarize these articles. We read the summary.
Yes.
You don't need to reply one by one. We'll wait for a few and then we'll reply to all of them and just make a conclusion about the answer.
And you get grading when you reply by a correct answer, and obviously wrong
No,
answer is not. No.
no,
Okay.
no, 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 no. Because it's teaching, is not from assessment.
Oh, okay.
Assessment is different.
Okay.
But here, MCQ, different style. I will show you the MCQ. This is an example. So, lecture, clinical scenario, journal club, and MCQ. I give this as an example. I answer, we have 5 questions,
Yeah.
and I answer the first one.
Yes.
So the pass mark of this MCQ is 70%.
Yeah.
So since I didn't get the pass mark, a sign will come up. You have
Yeah.
20% only, so it means you're failed.
Yes. We need to
Show the
retake.
answer
Yeah.
or retake. Look,
Yeah.
if you click on show the answer here, the, these MCQs, yeah, this is green means the correct answer,
Yeah.
and this is the explanation. Red is the wrong answer. Green is the correct answer, and this is explanation of the answer.
Excellent.
Then, because since I didn't get the 70% pass mark, I will retake the quiz.
Yeah.
So the quizzes will come like this, and you click on the
Retakes a
correct
quiz.
answer or the
Yeah.
wrong answer. It depends on the exam question.
Okay.
And then this is not different from the final assignment. Final assignment is designed the same way.
Yeah.
Look here, this thing, you need to achieve a minimum 70% to count the MCQ session as contribution. The complete button appears only when you achieve a minimum of 70% of the total mark.
Okay. Excellent. One of the things
Week
that,
2 is the same.
yeah.
Yeah, I mean, week 2 the same.
Yeah.
So this is a simple, a sample of what's studied
You
in the
studied.
fellowship
Yeah.
in clinical trial.
One of the things which come to my mind, because you are in the field of surgery, is the technicality, how you can have the surgical skills being assessed in e-learning. Would you, for example, let us say, do anastomosis of a graft outside the body, a synthetic graft, and do end-to-end anastomosis with 5O suture and record the video and give it to me for assessment? Is there is a way that e-learning can help in surgical skills?
The answer is no. The surgical skill is left to your own practice.
Okay.
The e-learning at our stage, look, if you are a consultant vascular surgeon and you don't know how to do an anastomosis, you're not a surgeon.
Absolutely.
But the e-learning will provide you with critical thinking. Should I do this case?
Yes.
What is the success rate? How
Yes.
do I counsel this patient? How
Yes.
do I manage post-operative complications?
Yes. I'm
But
thinking of something maybe a little bit basic. If we created in the VA Academy a course for MRCS, where there is part of their exam is related to skills of suturing, knotting, tying, draining of an abscess, and these sort of things. Is
the
there is
big
a way
difference
that
between
this can be in
yeah,
e-learning?
big, no, big difference between the MRCS. MRCS is for undergraduate.
Yes.
Undergraduate means not in the university, but they are not consultants.
Yes.
You are teaching your e-learning is for higher. Is basically teaches higher order thinking.
Okay.
So you pass this stage of doing a hernia, you pass this stage of, doing anastomosis, you pass this stage of, stripping a vein. Now you pass this stage.
Yeah. So e-learning
But
is mainly dedicated for postgraduate training
yes,
or for a consultant eagering to to
expand their
perfect his
knowledge.
job. Yeah.
Yeah, expand their knowledge and get themselves updated.
Okay. Okay. Excellent.
But e-learning is not a replacement by all means of on-site training.
Okay.
No way.
Yeah. Excellent. And I believe the website is www.kidney
WorldKidneyAcademy.org.
worldkidneyacademy.org.
www.worldkidneyacademy.org.
Okay.
Yeah,
And here you have plenty of courses that candidate can select from and can apply after paying certain fees. And after 6 months to a year, if he passed it, that he gets a certificate which is accredited worldwide.
yeah, exactly.
Excellent. Excellent. Excellent.
Regarding the fees,
Excellent.
e-learning is a lot cheaper compared to traditional didactic
Yeah.
learning.
Yeah.
You
And
don't
this
need to wake up
platform is
in the
successful
morning.
in your opinion.
Definitely, the whole world
Definitely.
now is e-learning.
Yeah. Excellent. Well, thank you very much. That's really very good explanation, excellent example, and a good experience, which is fascinating, which I'm sure will be continuously evolving. And you have structured, well organized e-learning platform with a clear vision and a clear objective that I'm sure it is the future. Definitely not an on-site training, and definitely it is for higher surgical training. I hope that we in our unit with VA Academy can learn from your experience, can imitate your experience, and hopefully we can have a collaboration once we created this maybe mutual workshop together or some sort of collaboration
Oh,
in order
definitely.
to encourage e-learning or maybe benefit from the new advances of artificial intelligence in this sort of learning objectives. That's nice. So your advice to any medical tutor is to start in year 2024 e-learning, otherwise he will be late.
Yeah, I mean, look, life is busy. And as I mentioned earlier on, we're always busy with work, busy with the family, busy with other aspects of life.
Yes.
So e-learning can fit in and fill the gaps.
Yeah.
You
Absolutely.
learn whenever you are ready, whenever you have free time. You are not attached, you are not limited and restricted by certain time. Lectures is audio lectures, not necessarily you wake up 6 o'clock in the morning to catch a train and to attend the lecture,
Yeah.
but you can listen to the lecture on your mobile.
Excellent. Excellent.
What you need is a laptop and internet.
Yeah.
Basically, these are the requirements. You don't need to be formally dressed.
Yeah.
You know, you can
Excellent.
learn in your pajama.
Yes, that's true. That's a big advantage. I would like to thank you very much for this very, very valuable 35 minutes of your precious time. And hopefully we'll have another webinar to explain more about e-learning, especially in the focus of vascular surgery and general surgery and laparoscopic surgery, what the platform can offer. And finally, the last question: do you have a plan of future expansion of your courses?
Yeah, I mean, is every year there's another course. So
Excellent,
we started with transplantation. Now, look, we have all these programs running.
excellent, excellent.
And this for the 2020, sorry,
That's all right.
2025, 2025, and we have a plan for 2026 as well.
Yes, good. That's fantastic. Thank you very, very, very much. It's very valuable. I'm sure it is the future. I'm sure it is the way ahead. I know that you have the weather in UK is not the best at the moment, and sorry about your cough, but we really appreciate your very, very valuable time and all your advices. And I will try to publish this lecture so a lot of junior staff can benefit from your fantastic website, which is
Thank you, man.
www.worldkidneyfoundation.org, and see the
Yeah.
courses, get the
World
summary.
Kidney Academy.
Sorry?
You know, if somebody Googles World Kidney Academy in one
Yeah.
word,
Yeah. If
the
you Google it,
platform,
yes, you will get everything. And that's it. We'll close the recording.